A close look at men's health on this Father's Day. We're joined now by Dr. Michael Romaine with the Austin Diagnostic Clinic. Talking about dads, so what are some of the key health concerns for men these days?
Key health concerns for men are, remain the same. Diabetes, smoking, inactivity, hypertension, and cardiovascular disease. The biggest thing is that men need to start going to the doctor on a routine basis to have routine screening done.
Why are men, less likely to maybe get there as opposed to the women?
That's the big question. No one really knows the real answer to that. Many different theories about not wanting to know what the real problems are, or is there a fear issue. Some of the tests may be a little bit invasive, and men have a problem with some of the invasive testing. So no one really knows for sure why.
So a good recommendation, when do you expect men should start getting their checkups? What age?
It really depends. It depends on what kind of medical problems they have. Some men are fine in their 20s, but a good percentage of men have hypertension or diabetes in their 20s, so they should start going on a regular basis. Some men can wait till their 30s, in their 30s if they have hyperlipidemia or high cholesterol and hypertension, but typically in the 40s when men used to get routine prostate checks and routine blood work.
Now, what are some of those signs, that they might want to look for when we're talking about health concerns?
Health concerns can be anything such as decreased urinary stream, to say your prostate is getting enlarged. The bad part about things with health concerns is you may not have any symptoms whatsoever. For example, if you have colon polyps, you may not have any symptoms whatsoever. You should go to your doctor, get your stool checked, get a routine colonoscopy.
And what are some of the things that men can do to prevent some of these things from happening?
Number one, seeing their doctor, increasing activity, basically not smoking, drink in moderation, not in excess, looking at their family tree basically and seeing what runs in their family, and then going to their doctor and discussing that with them so they get routine testing.
What are you seeing mostly, at your clinic, that things men are coming in for these days?
A lot of times the hardest thing is the colon screen. We talk to men and they've gotten a little bit past the prostate issue, but getting the colonoscopy is one of the bigger things. It's been taking, rather than at the age of 50 where you should get your baseline colonoscopy, people wait until 55 and 60, and sometimes we're finding cancers, multiple polyps, things like that. And we try to explain to them that the colonoscopy really can save your life. So that's what I've been seeing more recently.
Great. Well, thank you so much for being here. Dad, some good advice, right?
Thank you for having me.